हाँ जी, वेलकम करते हैं तुहाडा सारिਆਂ ਦਾ ਨਰਸਿੰਗ ਕਰੀਅਰ ਚੈਨਲ ਦੇ ਉੱਤੇ। ਸੋ ਜਿਵੇਂ ਕਿ ਤੁਹਾਨੂੰ ਪਤਾ ਹੀ ਹੈ ਵੀ GMCH ਸਟਾਫ ਨਰਸ ਦਾ ਐਗਜ਼ਾਮ ਜੋ 28 ਤਰੀਕ ਨੂੰ ਹੋਣਾ ਤੇ ਹਫਤਾ 10 ਕੁ ਦਿਨ ਹੀ ਰਹਿ ਗਏ ਮੇ ਬੀ ਇਹਦੇ ਵਿੱਚ। ਸੋ ਉਹਦੇ ਲਈ ਆਪਾਂ ਪ੍ਰੈਪਰੇਸ਼ਨ ਦੀਆਂ ਵੀਡੀਓਜ਼ ਅਪਲੋਡ ਕਰਦੇ ਹਾਂ। ਸੋ ਸਟਾਰਟ ਕਰਦੇ ਹਾਂ ਅੱਜ ਦੀ ਫਰਸਟ ਵੀਡੀਓ। ਕਾफ़ी ज़्यादा इंपॉर्टेंट क्वेश्चन आंसर ने प्रीवियस एग्जाम ਦੇ ਵਿੱਚ ਵੀ ਰਿਪੀਟ ਹੋਏ ਨੇ। ਸੋ ਵੀਡੀਓ ਨੂੰ ਐਂਡ ਤੱਕ ਜ਼ਰੂਰ ਦੇਖਿਆ ਕਰੋ ਤੇ ਨਾਲ ਦੀ ਨਾਲ ਚੈਨਲ ਨੂੰ ਸਬਸਕ੍ਰਾਈਬ ਐਂਡ ਬੈਲ ਆਈਕਨ ਦਾ बटन भी जरूर प्रेस कर दिया करो ताकि हर एक वीडियो की अपडेट तुहाडे तक पहुँच सके। सो स्टार्ट करते हैं आप फर्स्ट क्वेश्चन। सो फर्स्ट क्वेश्चन हैगा द प्रोसैस ऑफ प्रीवियसली डिस्ट्रॉइंग कैंसर टिश्यू इन द ब्रेन बाय यूजिंग फोटोडायनैमिक थैरेपी, क्रायोसर्जरी, गामा नाइफ सर्जरी, रोबोटिक सर्जरी। सो प्रोसैस ऑफ प्रीवियसली डिस्ट्रॉइंग कैंसर टिश्यू इन द ब्रेन बाय यूजिंग gamma knife surgery. Option C is the right answer. Next question number second. The lung volume capacity that does not change with pulmonary disease is vital capacity, total lung capacity, tidal volume, inspiratory capacity. So lung volume capacity that does not change with pulmonary disease, it's a total lung capacity. Option B is the correct answer. So ਜਿਹੜੇ ਇਹ ਕੁਐਸਚਨਸ ਨੇ MCQ ਨੇ ਮੋਸਟ ਇੰਪੋਰਟੈਂਟ ਨੇ ਇਹ GMCH ਦੇ ਜਿਹੜਾ ਸਟਾਫ ਨਰਸ ਦੇ ਪ੍ਰੀਵੀਅਸ ਐਗਜ਼ਾਮ ਹੋਏ ਨੇ ਉਹਨਾਂ ਦੇ ਵਿੱਚੋਂ ਹੀ ਅਪਲੋਡ ਕੀਤੇ ਆ। ਸੋ ਵੀਡੀਓ ਨੂੰ ਐਂਡ ਤੱਕ ਜ਼ਰੂਰ ਦੇਖਿਓ। ਨੈਕਸਟ ਕੁਐਸਚਨ ਨੰਬਰ 3rd. As a precautionary measure you will perform the following test but before taking a sample for arterial blood gas analysis: Homan's test, Allen's test, Edson test, Trendelenburg test. So as a precautionary measure you will perform the test before taking a sample for arterial blood gas analysis. It's a Allen's test. Option B. Next question number 4th. The device that can deliver oxygen at concentration of 90. Venturi mask, partial rebreathing mask, non-rebreathing mask, nasal cannula. So the device that can deliver oxygen at concentration of 90, it's a Venturi mask. Option A is the right answer. Next, 5th. The goal of pursued lip breathing exercise 2. Prevent aspiration pneumonia, strengthen the diaphragm, loosen the bronchial secretion, reduce the amount of trapped air. So goal of pursued lip breathing exercise to reduce the amount of trapped air. Option D. Question number 6. While performing endotracheal suction in an adult, so you will ensure that apply suction for at least 20 to 30 seconds at a time. Apply suction only for less than 10 seconds at a time. Set the wall unit suction pressure 40-60 mm of Hg for adequate suctioning. Next last is set the wall unit suction pressure at 180 to 200 mm for adequate suctioning. So ਜਿਹੜੀ ਆਪਾਂ ਨੂੰ suctioning ਉਹ less than 10 seconds ਤੱਕ ਕਰਨੀ ਚਾਹੀਦੀ ਹੈ। 10 seconds ਤੋਂ ਜ਼ਿਆਦਾ नहीं करनी चाहिए। सो ऑप्शन बी इज़ द राइट आंसर। नेक्स्ट 7th. A patient admitted in emergency is having tachypnea with a respiratory 28 breaths per minute. So likely diagnosis: narcotic overdose, raised intracranial pressure, pneumonia, brain injury. So it's a due to pneumonia. Option C is the right answer. Next 8th. On auscultation of a breathless patient, you hear cracking sounds at the lung bases. So most likely diagnosis: pneumothorax, pulmonary edema, bronchial asthma, emphysema. So pulmonary edema is the right answer. Option B. So काफ़ी ज़्यादा इंपॉर्टेंट क्वेश्चनस ने MCH ਦੇ एग्जाम ਦੇ ਵਿੱਚ ਵੀ ਬਹੁਤ ਵਾਰ ਰਿਪੀਟ ਹੋਏ ਨੇ ਤੇ ਇਹਨਾਂ ਵਿੱਚੋਂ ਹੁਣ ਵੀ ਕੋਈ ਨਾ ਕੋਈ ਐਗਜ਼ਾਮ ਦੇ ਵਿੱਚ ਕੁਐਸਚਨ ਪੁੱਟ ਹੋ ਸਕਦਾ ਵਾ। Next 9th. A patient is having pneumothorax is being treated with chest to an underwater sealed drain. So water level in the drain is oscillating rhythmically with respiration and there is intermittent bubbling. So this means The tube is patient and lung has fully expanded. The tube is patient but the lungs has not fully expanded. The tube is blocked and lung has expanded. The tube is displaced. There is surgical emphysema. So ਇਹਦੇ ਵਿੱਚ ਜਦੋਂ condition ਹੋ the tube is patient but the lungs has not fully expanded. So option B. Next 10th. The arterial blood gas that is most suggestive of respiratory acidosis. If the pH level 7.3, pH 7.5 and carbon dioxide 220 mmol of Gg, CpH 7.3 and last is 7.5, pH level 7.5. So arterial blood gas that is more suggestive of respiratory acidosis, it's a pH 7.3, HCO3 and 12 mm of well. It's a option C. 11th. A coronary artery disease patient in the cardiac care unit complained of sudden onset of breathlessness, blood pressure 160 mm of Hg. So what is the nursing action you will be performed? Administer intravenous morphine to reduce anxiety, prop up the patient in high Fowler position, send an arterial blood gas sample, call the intensive care unit for available of ventilator. So first nursing action is prop up the patient in high Fowler position. Option B. Patient ਨੂੰ high Fowler position ਆਪਾਂ provide ਕਰਨੀ ਆ. Next 12th. While checking the blood pressure in the upper limb of a patient with sphygmomanometers, you observe that she has developed carpal spasm. So most likely causes hypokalemia, hyponatremia, hypocalcemia, hyperphosphatemia. So in the condition of if the checking the blood pressure in the upper limb of a patient with a sphygmomanometer, then it's a car spasm. So it's a most likely causes hypocalcemia. Option C. Next question number 13. A file breaks out in a ward. So first action you should take. Sorry, file नहीं ਇੱਥੇ fire ਆਉਣਾ. PDF ਦੇ ਵਿੱਚ mistake ਹੋ ਗਈ. Sorry, it's a fire. A fire breaks out in a ward. So first action of a nurse taken. Call 101 fire brigade, shut off the oxygen supply, do use the fire extinguisher, evacuate the patient from the ward. So first priority की बनूंगी? Call 101 fire brigade. Option E. Next 14th. The following statement is true regarding transfusion of blood to a parent hemodynamically stable adult patient. 150 ml should be transfused in first 15 minutes. Blood should be administered slowly and complete not before 6 hours. Transfusion should be completed within 4 hours. Unit of blood should be warmed at bedside for 1 hour before starting transfusion. So which statement is true? The statement is option C. The transfusion should be completed within 4 hours. Option C. Next move to the 15th. The initial energy selection for defibrillation in pulseless ventricular tachycardia for a monophasic defibrillator is 32 joule, biphasic defibrillator is 16 joule, monophasic defibrillator is 100 joule, biphasic defibrillator is 150 joule. So option D, biphasic defibrillator is 150 joule. Option D. Next 16th. In a 78-year-old smoker with streptococcal pneumonia and difficulty in coughing out secretion, nurse diagnosis is community-acquired pneumonia with cough, pneumonia in an elderly smoker who needs chest physiotherapy, acute chest infection with weakness or chest muscle, last is in infective airway inclearance related to effect of pneumonia. So right answer is option D, ineffective airway clearance related to effect of pneumonia. So option D. 17th. A patient passes urine as given in the sequence Tuesday 8 ml 200 ml, तो 12 बजे 250 ml सी, 3 बजे 300 ml सी, 6 बजे 300 ml सी तो 9 बजे 250 ml सी। सो वैडनसडे ਨੂੰ 3 ਵਜੇ मॉर्निंग ਦੇ 200 ml यूरिन गया, 8 बजे 300 ml। then the 24-hour 8 to 8 am collection of urine for laboratory evaluation is quantified to be, its a total urine pass is 1600 ml, option B। next 18th, the bandage that is applied over an amputated knee stump while preparation for the prosthesis is usually as spiral bandage, figure of 8 bandage, recurrent bandage, circular bandage। so it's a figure of 8 bandage, option B। next 19th, a patient present to the emergency with a history of multiple bee stings and blood pressure of 80 by 50 mm of Hg, so he is having hypovolemic shock, spinal shock, hemorrhagic shock, anaphylactic shock। so it's a anaphylactic shock, option D। next 20th, the patient in the gastroenterology ward is on nasogastric tube with continuous low pressure suction, so acid base disorder you anticipate this setting is metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis। so the right answer is metabolic alkalosis, option B। so ये आज क्वेश्चन थे जो हमने डिस्कस किए, काफ़ी ज़्यादा इम्पॉर्टेंट हैं। सो वीडियो को एंड तक ज़रूर देखा करो। मिलते हैं नेक्स्ट GMCH के एग्ज़ाम की वीडियो में। ओके गाइस, थैंक यू।